My name is Ana Ortega, and I'm from Denver, Colorado. Why healthcare is important to me is because I didn't have healthcare. My family never really had healthcare. Even accessing any kind of public healthcare has been really difficult. Trying to find healthcare, trying to find a clinic that will see you without insurance is really, really hard. It's almost impossible, especially if it's an emergency, which is what happens when you don't have health insurance. You usually go in when it's an emergency and when it's really vital for you to get in at that moment. My mom and I both have private insurance, through our employers. It's been a lot easier to access healthcare and the services that we need. But before, money was the issue, not having any funds, any resources to really access the preventative care that we can now. A lot of the healthcare issues that affect Latinos are preventative. And it's very important to try and educate yourselves before you have to go into the emergency room. And it's very important to educate ourselves around healthy food to eat. Looking for resources as a Latina is kind of difficult, and accessing them, not so much for my immediate family, but for my extended family. Language is always a barrier in trying to access healthcare and getting the proper care that you need. Sometimes you don't understand what your doctors are saying. Sometimes you don't understand what they're asking from you or for you to do for yourself. Even just being afraid to talk to someone who doesn't know your culture is very difficult. It's almost like everything we do is bad for ourselves and for our health. So kind of overcoming that has been a really big struggle for our family. Accessing medications that are really expensive, or accessing surgeries that are needed, especially on an emergency basis. I'm hoping that it'll be positive and that more people will take advantage of what's being offered right now. One of my biggest questions is who is eligible? What resources are available for those who do have language barriers, and where to go to get help to find out if you're even eligible for it? Is there a cost to those who don't have an insurance plan already? And if there is a cost, are there ways to get it subsidized? What programs are available for those people who are seeking to access the Affordable Care Act? It's very important for Latinos in Colorado for many reasons, especially for our young people. It's especially important for them to learn how to access these resources. AIDS and HIV, anything that has to do with our own sexuality, accessing birth control, accessing abortion care services, accessing healthy food in our neighborhoods, accessing any preventative measures, exercising, definitely mental health. For sure, mental health. So many of our young people are facing mental health problems, and even in my own family, that's preventing our young people from doing good for themselves because they don't have access to those resources. Healthcare to me doesn't mean when you're sick to go to the doctor. Healthcare to me means that you prevent those illnesses from happening in the first place. So becoming educated on healthy ways to eat, healthy ways to live, and being able to access those resources through Obamacare is really important to me. I hope that that's what is in store for my family and for everyone else.